Hey, did you check out that video where I talk about what your breasts should look like and what breast cancer is? Well, as a continuation of that video, today we will discuss what investigations you should go through to evaluate your breast cancer and what the recent treatment modalities are. If you missed out that video, I have put the link in the description box below. So let's start today's discussion on how to deal with your breast cancer. So in my last video, I have talked about breast mammographies, sonographies and breast MRIs. And also now you know how your breast cancer might look and feel like. But to confirm that you have a breast cancer, what you need is a biopsy where a chunk of your tumor tissue will be sent for microscopic examination and your pathologist will tell you if you have a breast cancer. After the initial biopsy report, your pathologist will further investigate on the tissue sample and he or she will tell you about something known as IHC. IHC stands for immunohistochemistry, by which your doctor can decide whether your tumor will respond to hormonal therapies or targeted immunotherapies, that is also known as trastuzumab or Herceptin. I will come to this later on. In my lung cancer video, I have thoroughly discussed about immunotherapy and targeted therapy. If you missed it out, I have put the link in the description box below. You go check that out also. Your doctor will also ask for a whole body CT scan, a bone scan, and even a PET CT scan to know whether your tumor has spread to any other organs. The commonest being your lungs and your bones. Sometimes, if in doubt, your doctor might also ask for an MRI imaging of your brain to rule out any tumor spread in your brains. If your breast cancer is in early stage, your doctor might want to go for surgery directly. In the previous era of breast cancer treatment, breast cancer surgery consisted of removal of your whole breast, that is also known as mastectomy, along with removal of all your lymph node glands that are present in your armpit. But the treatment modality of breast cancer surgery has changed a lot in last few decades. Now we have understood that removal of whole breast does not necessarily reduce the coming back of your breast cancer more than the new age treatment modality, that is breast conservation surgery. In a breast conservation surgery, we only remove the diseased part of your breast and save the rest of the gland. This surgery is also added with a breast remodeling surgery to give you a very good cosmetic outcome. In the era when we used to remove all the lymph nodes from your armpit, many patients used to come back with complaints of a swollen limb and reduced functionality of that arm. To deal with that, we have come up with something known as sentinel lymph node biopsy. You might have heard your doctor mention the term somewhere. Here we inject few dyes in your breast which will spread to your lymph nodes, and we will check the particular doubtful lymph nodes to see whether they are involved by your cancer. If there is no cancer, we can avoid an add-on morbid surgery on your armpits. Now, if your breast cancer is little bit advanced, where upfront surgery is not recommended, then your doctor will ask you to go for chemotherapy. Nowadays, chemotherapy drugs are so effective that it will shrink the tumor in size, and maybe we can go for a breast conservation surgery. Even if we cannot save your breast, at least we can go for the mastectomy procedure that I talked about, that is removal of your whole breast so that you get rid of your cancer. With advancement of plastic surgery techniques, now we can use tissue expander, silicone or other forms of breast implants, or a flap transfer surgery to give you an almost natural looking bulge in the place of your breast so that you do not lose your looks or beauty standards. I am thinking of making a whole separate video on breast remodeling surgeries, and you will be amazed how far we have reached in this particular area and how advanced we have got in breast cancer treatment. In this era of multimodality treatment, we form a tumor board where we discuss with our medical oncologist colleagues, our radiation oncologist colleagues, our pathologists to decide what chemotherapy you should get, when you should get radiation, what surgery you should go through to give you the best outcomes. Most of the time, you will be given chemotherapy before or after the surgery. This will reduce the risk of coming back of the tumor somewhere else in your body in some later time. Like I discussed previously, it can also reduce the size of your tumor so that a smaller breast cancer surgery will be required for you. After a breast conservation surgery, or sometimes even after a breast removal surgery, you will be given radiation over your chest wall and your armpits to ensure you remain cancer free forever. Did you know your cancer might be responsive to hormonal therapies? Your pathologist will give you a report known as immunohistochemistry, where they will mention something known as ERPR status. It stands for estrogen receptor and progesterone receptor status. If these receptor status are positive, then your breast cancer will respond to simple hormonal medicines. You will be advised to take hormonal pills like tamoxifen, raloxifene, exemestane, letrozole, and such drugs. These are not chemotherapies and they have very minimal side effects, but they can reduce the chance of your breast cancer to come back ever. Similarly, if your disease is HER2 positive, that is another IHC marker, then your tumor will respond to targeted immunotherapies like trastuzumab, pertuzumab, olaparib, such drugs. After completion of your successful treatment, you will be called back to the doctor for a regular interval follow-up. Usually, we call patients 3 monthly for the first 2 years, 6 monthly for the next 3 years, and annually after that till the rest of their life. Also, an annual mammography will be done to check your residual breast and the opposite breast to rule out if there is any recurrence of the tumor. Sometimes, if your family has BRCA positivity or many of your first degree relatives have already suffered from breast cancer, or rarely if your biopsy report says you have something known as LCIS or lobular carcinoma in situ, then you have a very high risk of developing breast cancer in any of your breast. In that case, your doctor might ask you to go for something known as prophylactic mastectomy, that is removal of both of your breast, and it will help you prevent breast cancer from even developing. You may have heard of the great actress and entrepreneur Angelina Jolie, who underwent a bilateral prophylactic mastectomy because she had a high risk of breast cancer, and she has set an example of breast cancer awareness worldwide. Now, if in case you have a stage 4 cancer, where your cancer has already spread to different organs and surgically your disease is not curable, then you can be given palliative options with chemotherapy, hormonal therapy, targeted therapy, and these will give you a long, comfortable life with slower progression of your disease. So many chemotherapy drugs and injections for your breast cancer treatment. Will this make your life a living hell? No. We have PICC line, Hickman line, or chemoport that can save you from tolerating multiple needle pricks. Always remember, you can enroll yourself in some clinical trial if all the treatment modalities are failing when you have a stage 4 or metastatic breast cancer. The last thing that you need to do is to like and share this video and subscribe to my channel. Your love and support keeps me motivated to create such videos to help people in need. Have a nice day. See you next week with my new video. Bye bye.